Hello, so this will be the beginning of trimester 2 vlog. I felt like in the first vlog I just had so many emotions. Sorry, cat just came up. So many emotions, so many fears, so many unanswered questions. I think I just wanted to try and document so much of it. What I will say is I'm actually a lot further on than the last time I saw you. So I'm actually 17 weeks at the moment. I think the last time I filmed I was maybe 13 weeks. And the reason why I've not done any kind of filming in between that is because my appointments with consultants and other things that have been going on out with my own diabetes and heart stuff have been happening, and I wanted all these things to kind of go underway and have a bit more stuff to tell you. I'm still very breathless. Sorry, Pebbles in the background here. She won't leave my side. The two of them have become the sukiest cats. They're very affectionate cats anyway, but since being pregnant, the two of them, I think it's probably because I've been in the house a lot more as well, to be honest, but they won't leave me be. She loves lying on my stomach quite a lot, so even Molly has been doing it and she's not inclined to really be a lap cat as such. But anyway, as I was saying, this is how things end up fucking an hour long. Yeah, so I had all these appointments. So let's give you a brief overview of what's been happening. In week 14, that was a week after the last time I spoke to you, I had my appointment with my diabetes consultant, my diabetes obstetrician consultant, and I again flagged up the fact I was still bleeding every week, twice a week maybe, sometimes pink, sometimes brown, sometimes bright red, sometimes clots, and it was very unnerving. And obviously I'd been to A&E, I'd spoke to someone there, but it was still happening, and the obstetrician, who is my obstetrician, was very, very nice, and she was like, that's no way to be in a pregnancy, like you shouldn't be worrying like that, let's have a look, let's see. She kind of was like, I've not seen what other people have seen, so she hadn't seen what my gynecologist had seen maybe like was it 3 years ago, 2019, 2018, and the registrar that had seen me after I went to A&E, she hadn't seen that either, so she wanted to have a look herself. So she had a look that day and she swabbed my cervix like directly, rather than the lady who'd seen it at A&E had just done a vaginal swab, whereas this consultant had done direct swab on the cervix and the blood flowed. I think even she was kind of shocked at the amount, and she was like, oh god, yeah, it really does bleed, doesn't it? And I was like, well, yeah. About 5 days after that, I continued to bleed. Not profusely, I wasn't soaking through pads or anything. That day I did. That day I had to swap pads a couple of times, but I wasn't bleeding profusely in the days after it, just as it had been. But she said to me basically that day, I'm going to do urgent referral to gynecology. I just want them to look at it, just in case they're the experts. Let's get a colposcopy done, which I'd had done in my early 20s. If you don't know what a colposcopy is, I would love to sit and explain it to you, but as I said, I don't want this to be too long, so you can Google it. It's basically where they go in with a camera, have a look at the cervix, see what's going on, and I had had that done in my early 20s because of an abnormal smear test. So she basically just wanted them to have a look. So there was all that. With regards to the diabetes, they were very, very happy with me. Everything is going quite smooth. Cardiology, now I have appointments with them as well, following the appointment I had with my obstetrician. I will see them at the end of this month. It is November at the moment. And next week I have another appointment with my diabetes consultant, obstetrician, and then I will also have a scan, which normally you have your 20-week scan, but they're going to do mine at 18 weeks instead. At the time, I think that was partly to do with this bleeding as well. She was like, let's just bring it forward a bit, let's just have a look. And she wanted to do an internal scan to check the length of my cervix. Now, last week I went to my gynecology appointment, the urgent appointment they'd sent through for me. It was the gynecologist I'd seen back in 2018 or 19, and she was not worried. She was quite reassured. She said it is that's bleeding, but I'm not going to do anything. You don't need any biopsies done. I wouldn't even do a biopsy in pregnancy anyway, she said, but it's just some granular tissue. I'm not that concerned about it. What they did do is apply some silver nitrate, which is a little bit like an acid or a vinegar. They applied that and told me that should ease off the bleeding, hopefully. I have to say, it's been about a week. Yeah, so what day is it today? It's Tuesday today, and I went last Wednesday for that treatment. And the bleeding has been back to what it was, like back week 7, 8, 9, 10. And it felt like after that big bleed with the consultant that day, it seemed to really tail off. Weeks 15, 16, no, tell I, 14 and 15, the last couple of weeks, had really tailed off. And then last week, when I went for that procedure, it has just been fucking bleeding ever since, so. But it is the way it was before. It's not as bad, it's not worse, it's just the fucking same. So when I see them next week, I'll say to them, look, I know I had this procedure done, but actually the bleeding was much improved before the fucking procedure, and now it's worse. So I don't know what they'll make of that. And obviously I will get to see the baby, and it will be the Anomaly Scan, which, as I say, is normally the one that happens at 20 weeks, but I'm getting it done at 18. So we have that next week. And then at the start of December, I have an MRI for my heart to check that that's okay. I'm not that worried about that. It's weird. I'm not worried about the cardiology stuff. I'm not worried about the MRIs for my heart, because I had the operations done on my heart when I was so much younger that I'm like, surely it's still okay. And I had an MRI done in May, pre-pregnancy, and they said it was fine. So I'm just hoping that it's the same. It's all the maternity ones now that are really anxiety driven and nerve-wracking, because I still obviously have all the fears that any pregnant woman has, that the scan will be normal, or is it normal, like healthy, things will be okay, baby will be alright, I will be alright, like all that kind of stuff. Now that they've kind of got to the bottom of the bleeding, it doesn't help that I'm still bleeding, but because I've had a bit more of a solid answer and someone's had a look with a camera and stuff, they basically just said, oh, you'll go back to your routine smears, because I am due one at the moment, 12 weeks post-pregnancy, but that was it really. So I won't really have anything else to update you up until next week when we have our scan. What I can say is though, that in myself, I feel much better. The nausea has definitely subsided. It still comes and goes, and it is mainly when I'm hungry. So if I get up in the morning, I feel a bit squeamish, and then I'll have my breakfast, I'll feel a little bit better. Then about 11, 12 o'clock, I'll be like, I need a snack or something. Maybe I won't need my lunch, but I'll need a snack. And if I have something, then I feel better. Anytime if I notice my blood glucose is just, even if it's sitting about 4 or 5, I do feel a bit squeamish. If it's a little low, that's not low, but if it's getting lower, I do feel a bit squeamish. But obviously I don't want it to sit high all the time either, so it's a balancing act. But as I said, that side of things isn't really bothering me just now, and the bleed side of things, although it's not great, is not worrying me as much as it did. It's just all the other normal pregnancy anxieties that I think most women have. Today I'll show you my bump in a minute, because I'm 17 weeks now. I don't think I've shown it since ages and ages. So I'm gonna try and get on. We've got an exercise bike in the house that we pull out of a cupboard to use every now and again. Actually, after I'd seen my consultant and that kind of big bleed, after she swabbed me, she was like, I wouldn't do any exercise, I would just walk, don't do any exercise. So I couldn't do any normal exercises I liked, but now, as I say, with the answers that I've had from gynecology, I feel like going on a sedentary bike, like a stay still bike, and having a cycle, easy. I've just always got it quite turned down and stuff like that, and just watching something on the telly for half an hour is better than doing nothing, because I am also aware that I have not been doing as much as I would like in this pregnancy, because I haven't been at work because I've been so sick. Then the COVID, like the instances of COVID in my work, because obviously I work in a hospital, increased greatly, and they actually had to shut a few wards and things. So my manager was like, no, it's not a safe place for you just now, you can't come in, and that was that. I didn't have a choice. And now I've been in discussion with her again. I will speak to her next week about coming back, and she's been very understanding and actually was kind of like, do you know what, let's get all these specialist appointments out the way first and then we'll think about getting you back, because she's not, I suppose she knows I'm a high risk pregnancy, she knows I'm a high risk COVID person, and she just wants to know her staff members will be safe, which is really nice. So I probably, hopefully, will be going back to work, or thinking about going back to work at the end of this month. And then I'll be knackered, no doubt, because going back to doing 12.5-hour shifts, hopefully it'll just be like a phased return, but it's going to be a real shock to the system after being off work for the better part of 4 months. And I have been out and about a bit more. I have been out meeting friends for a coffee and stuff, so that's quite nice. Not coffee, usually I'll just have a hot chocolate or something. Still can't really drink coffee great, but I have had the odd decaf coffee every now and again. I'm able to take it now, and sometimes I'll just take a wee notion and be like, oh, have a little coffee. But a lot of the time at the moment, hot drinks are still not great, and I love tea and coffee. It's so strange. What else was I going to say? My skin, you can probably notice here, has been breaking out a bit. I have found my skin has got so much more oily throughout all of this. I am normally a dry skin person, or normal leaning to dry, and now I am definitely normal leaning to oily, like definitely. So that's been a bit strange. As for people being like, oh, you get this great hair and you get glowing skin and all that stuff, it's funny because some of the things I've put up on Instagram, because obviously it's not knowledge to anybody yet on social media, people have said like, you look great, like you look so healthy, you look glowing, like, and they've not known I'm pregnant. But at the same time, I'm like, I think this is a myth. I think it's a myth. This glowing, this blossoming period, I think it's a myth, because I am just constantly feeling like a pure grease ball. I constantly feel frumpy, bleh. But I have found, I've picked up a couple of maternity things, not very much, jeans and a couple of knitted dresses, because we're now in November in Scotland and it's very cold. But I haven't found the need to kind of buy a lot of maternity stuff yet. I've just been wearing the stuff I already have and doing the wee tricks where your belt kind of loops with a bobble and stuff like that on your jeans, things like that. I'll maybe do a little kind of overview of what I've been wearing while pregnant at some point once this is more common knowledge, but at the moment, obviously, no. It's funny actually, because I did post something up on Instagram. I'll just put it here. This photo, and loads of people messaged me and they were like, where's your dress from, where's your dress from? And I hate, you know, when you message somebody and say to them, oh, that's lovely, or you meet them in the street and you're like, where's that from? They're like, oh, I can't really remember. Like, shut up, where's it from? Just tell me where it's from, don't be a dick. And I felt like I was being like that a little bit, but I didn't want to link them to the dress because it clearly said maternity on it, and I was like, shit. So I said, oh, it's out of stock, but wait, I'll find something similar. I found like other ones to send them to instead, because I was like, oh shit. So I don't think anybody's quite worked it out yet. But yeah, let me show you my bump, and then I'm going to go and get on the bike for a bit. And then I'll probably check in with you again next week once I've had my scan. That has now been 15 odd minutes of chatting. But as I said, this one is not going to be quite as in-depth, I don't think, unless there's anything untoward happening. But we'll keep you up to date with how I'm feeling. Alright, so still in workout gear to show you this stuff. As I say, from the front, I don't think I look too different. I think you could get away with it. Always got my big bum and my big thighs, nothing has changed there. What I will say is the breasticles. The breasticles are definitely bigger. I've noticed when I've been putting on bras as well, I still haven't had to buy any new fitted bras or anything. I bought a couple more soft bras, but that's more for just my comfort. But they definitely, even in the older soft bras, I feel like, see this cleavage? That's not me trying to make cleavage, that's just there. Like, that never ever would have happened to me before. I'd have had to have been like that to make a cleavage, and now it's just there. So they are definitely a little larger. As I said, you can kind of see here, not too much change. I will turn to the side. Not too much change, like really, but I do feel like, so at the moment it's still the morning, and I do feel like as the day goes on, and I don't know whether it's I just get lazy in my posture or what have you, this does start to really stick out. That's me pushing my stomach out, obviously. But if I stand kind of normal and keep good posture, there's not that much difference yet. But I messaged some of my friends because I was really worried. I thought, not really getting any bigger. Like, is this normal? Like, I don't feel like I look... Obviously, I know I'm getting bigger because there's certain genes and things that won't fit me properly anymore. But I'm not really getting that shape. Like, I don't think I look obviously pregnant at the moment. I just look like I've put a few pounds on here and there. And basically they were just like, you've got loads of time, don't worry, just be thankful, because by the time you're 30 odd weeks you'll be like, fucking my god, look at the size of me. I think as well because I've got a friend who's also diabetic, and it's basically a bit common knowledge and kind of a normal thing for diabetic ladies to have bigger bumps and bigger babies. I was expecting to get bigger a bit faster. So as I say, week 17 at the moment. People I've been looking at who are now week 20, like my friend who also has diabetes, looks properly pregnant. So I'm wondering if I will go the same way or if I will just stay a similar shape to what I am just now. I don't know. I definitely, like, I know I've put weight on, but yeah, I don't feel like it's really that different yet. So we shall see. We shall see, and we will leave it at that just now. And I'll go and get on the bike for a bit. And I'll come back to you probably, hopefully, when I'm slightly more better, tired and looking a bit better. Because I feel like in all of these vlogs, I'm just going to look like a mess. But that's pregnancy for you. Fuck it. Hello, so I thought I would come and give you a little update. And I know, I look very glamorous. Today is the first time I have felt like I might want to start filming for YouTube again. Which, in the context of these vlogs, is going to seem a little strange. But I am currently 20 weeks pregnant, just because with everything that was happening in the first trimester and into the second trimester, I just did not feel comfortable getting on YouTube and talking about makeup and skincare and things like that, because I had so much on my mind. But I put a little slap on, little winged eyeliner, little red lip, a bit more of a Christmassy look that I was going for. And I'm actually going to film a little favourites and a catch-up video at the moment, but at this point, as you see this in that video, I have not said to anybody that I'm pregnant yet. I know I'm 20 weeks at the moment, and a lot of people announce their pregnancies on social media way before that. But personally, I'm just not ready for it yet. I'm just not wanting to open those floodgates. I'm just not ready. I don't know what else to say to you. But I thought I would catch up with you because I think the last time I spoke to you I was 17 weeks, and obviously this is the second trimester vlog. As you can probably tell, I am feeling much better in myself. I'm not feeling the sick way that I did all the way throughout the first and into the second. At the moment, as we speak, the bleeding has stopped, so we'll just keep fingers crossed on that. And that was following the procedure I had done with gynecology. I think I've already mentioned that. If I haven't, I apologise. So I have also had my 20-week scan, but I had it done at weeks 18. And I will have another scan following that one at weeks 22, because I'll be 21 next week and I'll be 22 after that, and I've got another scan on, no, tell I, 21 weeks, because it's next week. I have another scan for Anomaly, I suppose. I don't know how often they're going to be doing this now. I want to say maybe 4 weekly, but I also don't want to get my hopes up and think that I'll get a scan every 4 weeks. Obviously, because of my background, that is why they are doing these growth scans. With regards to my diabetes and things like that, the team are very happy with me at the moment. The last time I went to see them, which would have been mid-November, and as I speak to you, tomorrow is the 1st of December. Christmas. I've not even done a fucking thing for Christmas yet. I've not even started. I don't even know where to start. I've just had so much on my mind. And I also haven't filmed any Christmas content either. So at this stage, I'm just like, that has been putting me off getting back to filming as well, because I know people will be expecting me to come back chatting about Black Friday and Christmas and all this kind of shit, and I just feel like I have not prepped at all this year, and that's also made me feel a bit funny about filming again. Anyway, that's by the by. because I'll probably have been filming by the time you see this, sorry. But yeah, basically these scans going forward, the diabetes team were really happy with me. The last time I seen them, my blood sugar was in target at 76%, which is pretty good. And then I think I was, I don't know, maybe like 15 to 19% low, and then the rest high, which is actually pretty good. But they obviously want to get those lows under control. So actually in the last 3 days, today is Tuesday, and on Friday I got the training for the Medtronic Guardian, which works alongside my insulin pump. Now, for anybody who doesn't know here, if you're new here and you're just watching this as part of a pregnancy vlog, I am a type 1 diabetic, and I do have cardiology, I was going to say cardiological, cardiology history as well. I've had heart surgery, so that's why there's so much input from the medical side of things, and I am seen as a high risk pregnancy. So they wanted to get me on this Guardian monitor, which is a little bit like the Libra that you might see people wearing on the back of their arm, but mine is basically working alongside my pump. So I'm just going to lift my dress up, and also since I seen you at week 17, the bump has definitely become more pronounced. And for instance, look, like I said this to you, the boobs, I don't know what to do with these tits. I'm not even gonna lie. Like, I have never had a large chest in my life, and now I've just got these big bosoms. I'm not even wearing a proper bra, it's just like a little sports bra. I've just got these unruly boobs that I can't get things buttoned over. I mean, obviously once the bump starts to get really big, then that's going to be by the by anyway, but I found clothes so difficult at the moment because I can't even get things buttoned at the front to try and wear something baggy. Oh, don't even ask. But I'll show you my stomach. So if I stand up, also probably covered in cat hair because these are black and Molly is a white cat, so my apologies. Yeah, so if I lift up, that's my pump there, you can see, and this is the new sensor here. As you can see, the bump is definitely getting there. This is the new sensor. Now what this does is reads my blood sugar every 3 minutes, I want to say, and then it sends the information to the pump. The pump then decides whether I'm too high or too low. Obviously I set those parameters, hold on. I set those parameters working alongside my team, my diabetes team, and they decided for me what I would be sat at and when it will alarm and let me know that I have low blood sugar. But unlike the Libra will alarm and let me know because obviously I had an app on my phone that I could scan the Libra with. This one will automatically tell my pump to stop giving me insulin to avoid those hypos that I've been having. So that is really, really interesting. Unfortunately, so the first one I put on Friday worked a treat. It was fine till about 2 o'clock on the Sunday, and they're meant to last 7 days. It just went defunct, it didn't work. And I thought, oh God, what's happening here? I put a new one on, I tried it in a different place, tried to set it all up again. It started working, that was fine. And then I went to sleep overnight, that was no problem. And then yesterday, because today's Tuesday, I don't know, about the same time again, about 1 o'clock, 2 o'clock, it just went defunct and stopped working. And then I tried to recite it again, this time on the back of the arm instead of the stomach, because you can use both places. And I reached out to one of the Medtronic reps and asked her, and she said, why don't you try it in a different place? And again, it didn't work and it went defunct. So as we speak at the moment, I've just placed this one today to see again. It's currently, I don't know if you'll see this, it's saying warm up. I'm waiting on it saying calibrate, because then what it wants you to do is give you your blood sugar in, and it kind of checks to see that its reading is relatively close to what your blood sugar monitor says. You have to calibrate it at least 3 times a day. No, tell I, at least twice a day, 12 hourly. But they advise still doing it before breakfast, lunch, dinner and bedtime. So that's what I was doing until it just completely and utterly gave up the ghost. So that's the diabetes side of things at the moment. As for the 20-week scan that I got at 18 weeks, everything is looking fine with baby, which I am thrilled about. Oh, see, as soon as I start talking about stuff like this, I start to well up because I was so scared. And that first even 19 weeks, like even up until the last 2 weeks, I haven't really been settled because it's just been tough. It's been so tough. the sickness up until about 16 weeks, the blood sugar's been all over the place, the bleeding, everything. I have just not felt settled at all. I hate to say this, because if you are watching this and you're not pregnant, you've not been pregnant before, in those first 17, 18, 19 weeks, I did not enjoy pregnancy. I can't sit here and say that I enjoyed it the way other women are like, oh, I feel like so good, I feel like I'm blooming, like this is great. It was just anxiety ridden for me, and I think I'd rather be honest about that than like kid on it's all rainbows, because it's fucking not. Even now, I still worry all the time, and the people that I've spoke to, as I say, like our close friends and family now know that I'm pregnant, but I've not put anything on social media yet. Anyway, I spoke to who already has had a child, God bless them, are like, you'll never stop worrying again now, because even when they're born, you will worry about them all the time. So it's been, yeah, life-changing, obviously, like fucking duh, like fucking obviously it's life-changing, but I don't think I was prepared for quite how hard this was going to be. And I know a lot of people have wonderful, like uncomplicated pregnancies, and they just absolutely lap it up and they love being pregnant. I'm not for a second saying I don't want to be pregnant. Jesus Christ, no. I have now came this far that I'm like, I cannot wait for this little person to be here. I love them so much already, but it's hard. It's so hard when I hear people saying like, I loved being pregnant, it was great, I loved it, it was such a nice time in my life. I just, at the moment, feel like I don't know if that's how I will look back on it, and I'm sorry to be negative, but I would rather be honest. It has been full of anxiety, full of complications. It's not been a smooth ride so far, but what I will say is that now, as I say, in the last couple of weeks, I've started to feel better. I've started to feel a little bit more like me. Actually put, like, I've been putting makeup on. We've been going to the cinema quite a lot. We've been having a little date night every week still, and I'm starting to feel a little bit more like me, and actually like I want to do YouTube again, I want to do videos and things like that. So I am gonna go and do that now and actually edit a video for the first time. So I'm not gonna mention it on this video, obviously. I think at the moment I'm gonna see how I feel around about Christmas, because I'm actually going back to work next week as well, and the new variant of COVID has just released, like just pre-Christmas, just the South African variant. So I'm seeing how that's going to go. I'm supposed to go back to work next week, starting off with early shifts before I go back into the 12.5s, if I can cope with that. My management, my boss, have been more than supportive. I have to say thanks for that, because sometimes, like, I know in certain places, like, people don't even get maternity leave even as a woman. Like, I don't know how. I am so lucky that because I work for the NHS, they're very understanding about these things, and personally my boss is very understanding about my situation and how I'm high risk and blah blah blah. So going back next week to see how that goes, and I think once we get to Christmas I'll see how I'm feeling. I'm not going to be able to hide this bump any longer on things like Instagram. I'm wearing a very big baggy dress today, possibly under things like this, but it's not going to be able to be hidden too much longer. So I think maybe early New Year, or maybe at Christmas, I'll let the cat out the bag. I don't know yet. We shall see, and I will catch up with you. So next week I've got another scan. I've got an MRI for my heart as well. I seen my cardiology team last week, and I also had, no, I've got my booster, my COVID booster vaccine. I had my whooping cough last week and my flu jab. So I have all that next week. We'll see how that goes. I then am seen on the 15th by my diabetes team again, and hopefully this sensor is working by then. Cardiology were pretty happy as well, just to let you know that they were okay, but I have been told from the outset that if I want to request a C-section, what I was told was there's no shame, there's zero shame. This is obviously a very complicated situation as opposed to someone who has zero complications and they're just on a straight path pregnancy. So I said to them, I'm not coming in saying I want a C-section or I want to do natural. I am very much at their beck and call, and I'm very much kind of going to go with what the experts advise. I think for a lot of people and a lot of things that you read, a lot of books that you read, I will tell you what books I'm reading, or I will have already told you what books I'm reading. I don't know, because this is like a vlog, even though this looks a little professional now because I've got a light on. Everything that you read is very catered around natural birth, very catered around that, and very little mentioned about C-section, which makes it difficult for someone who pretty much is thinking that's the way things are going to go. But also everything is always very much like you are in control. You are in control of how you want your birth to go, how you want their pregnancy to go. And although I completely agree with that, I feel like I would rather hand over the control to the professionals in my situation, because there is so much to take in. I want to do what's best for me and for this little person. Oh, I should say as well, we haven't found out the sex. We don't want to find out the sex, and we may in the future, but if we do, I don't think we'll be saying anything on social media what they are, because we just want to be old-fashioned that way. We just kind of want to wait and see what happens, what pops out at the end. So yeah, basically I want to do whatever the experts say to make sure that everything is safe for me and for baby. So cardiology, we're like, you know, we don't let people like you push for hours on end. It just doesn't happen. And because of that, I'm kind of like, why put myself through the trauma of natural labour for, even if it's 3 hours, 4 hours, I don't know, knowing that I am not maybe going to be able to push a baby out in that time. And it's difficult because you don't have a crystal ball, because some people do push out their baby quite quickly, other people, they take 3 days, you know, like it's completely different. There's no crystal ball to this, and because of that it makes it really difficult, because I just feel like, do I want to go down the route of, right, let's do a natural birth, let's give this a go, let's see if my body will do it, or do I want to know that it's going to be more like a surgery? And I've seen C-sections being performed, I've seen that because of my job, and it'll be a little bit more controlled. And I know like lots of people have C-sections which are emergency C-sections and they still have a very nice experience, but personally I just think that emergency situation, which sometimes I work in, I don't want to be on the receiving end of that. That is the honest truth. And I think I would rather things were just a little more controlled and safe. But we shall see. It doesn't mean to say that I won't have a natural birth. The diabetes people said, you know, if they monitor the growth along the way and the closer I get, baby looks like they're 6-7 pounds, like a normal weight, then absolutely. If I want to try naturally, they will let me. And so cardiology said the same, but they just don't let me push for hours. And basically if they do the growth scans and it's looking more like a 9 to 10 pound baby, then they said, that's when they said to me, there is zero shame in asking for a C-section if you would prefer to go down that route. Why would you put yourself through that? You know how hard it would be to kind of squeeze out a 10 pound baby, and you have all these other complications on board as well. So that's where I am at the moment. As I said, I'm set up to be filming anyway, so I thought I would just pop on, not really vlog, it looks a little more professional than a vlog, I know, but I'm going to go and film a little video now, which I'm quite looking forward to doing, and I will catch up with you again if I know any other information, or if anything else happens, anything happens in work and I can't go back to work or whatever, I don't know, and I will see you again soon.